Hi everyone, welcome to our channel. I'm Dr. Rajesh Mehra, Medical Director at Integrative Hyperbaric in Loudoun County, Virginia. With over 40 years of experience in family medicine, I've dedicated my career to helping people heal and thrive through innovative treatments. And one of those newest treatments is hyperbaric oxygen therapy. We're going to be discussing what it is, how it works, and what and who pays for it. At Integrative Hyperbaric Center, we are passionate about providing top-notch hyperbaric treatment for both insurance-covered and non-insurance conditions. Hyperbaric oxygen therapy is a medical treatment where patients breathe 100% oxygen in a pressurized chamber. This increased pressure allows your lungs to gather more oxygen than under normal conditions, which then dissolves into your blood plasma. So why is this important? Oxygen is essential for healing many areas of the body. Hyperbaric oxygen therapy helps deliver this vital oxygen to tissues that need it most, especially in cases of circulatory problems, non-healing wounds, and inflammation throughout the body. At Integrative Hyperbaric, we offer medical-grade hyperbaric oxygen therapy in a single occupancy chambers. There are chambers which are called soft shell, which actually are not medical grade. They have much less power than our chambers. They can be used, but not for all conditions that hyperbaric oxygen therapy is indicated for. Each session lasts between 60 to 150 minutes, depending on the condition being treated. You might be wondering, who can benefit from hyperbaric oxygen therapy? The FDA has approved it for several on-label conditions. Let's list a few of those here so you become familiar with those conditions. Post-radiation injury. What does that mean? That means that people that have radiation for cancer and then get side effects can be treated as indicated by the FDA. Osteoradionecrosis and soft tissue radionecrosis. I realize those are kind of big words, but translating it into simple language, after certain kind of radiation, some tissues, some bones also get affected, and hyperbaric oxygen therapy is a way to heal the bones and heal the soft tissues after radiation. This is very important in the dental world also, where people are treated for different kind of oral, soft tissue, and bony cancers. Compromised skin grafts and flaps. This is important in any kind of post-surgery cases, whether it's abdominal, breast, and sometimes even cosmetic surgery where things don't heal as the surgeon would expect. Refractory osteomyelitis. That means that bone infection that's not responding to antibiotics and intravenous therapy. Diabetic foot ulcerations. This is a very common condition that is seen throughout with people that have diabetes. They develop ulcerations, especially of their feet, sometimes other parts of the body as well. Sudden hearing loss, which is most of the time caused by some unknown nerve problem. This is important and seen a lot by our ENT colleagues who deal with this a lot, where people lose their hearing all of a sudden, and there's really no reason for it. Hyperbaric oxygen therapy will definitely be able to improve the hearing. Blood loss anemia. This is when your blood count goes low for reasons that we may not know. Of course, as I tell you all these conditions, I want you to understand that the indications for this is along with the doctor that's taking care of these conditions. This is not a cure-all treatment, it's all to help these conditions. Crush injury, that's when you get in accidents and you get crushed soft body tissues. This will help a whole lot. One of the indications seen in the emergency rooms very often is carbon monoxide poisoning. This tends to equalize the oxygen ratios and helps the overall condition of carbon monoxide poisoning. Decompression sickness, of course, this is how things got started when divers went into submarines and other underwater issues. People got decompression sickness, and giving more oxygen and 100% oxygen would improve all the conditions and symptoms that they would have from this. These off-label uses are based on preliminary research, clinical observations, and patient testimonials. Throughout the industry of hyperbaric oxygen therapy, these conditions definitely improve after treatments. More studies are needed in these conditions, but there's been significant improvements in these conditions after treatments with hyperbaric oxygen therapy. There are many published studies which continue to show improvement, but understand not cure. Long COVID. This is a condition which is very common with all the people that got COVID during the pandemic. People still have residual symptoms which involve the lungs, the heart, and generally feeling fatigued. Plastic surgery recovery. I mentioned that earlier with flaps and other skin healing conditions. Anti-aging. There are certain individuals that do this just to live longer, feel better, and for good health. Cancer cure. While controversial, it does help the conditions and the side effects of chemotherapy and overall generalized feeling better. Head injuries, concussions. This definitely shows improvement and perhaps speeds up the normal process that the brain goes through. Alzheimer's and dementia. These are very important conditions which are increasing throughout our country and the world. These conditions and the symptoms of agitation, insomnia are helped. Crohn's disease, sports injuries, Lyme disease, which is varied in all its symptomatology, is definitely helpful. Autism has been shown to be helpful and changes the children's personality and children's ability to interact in an immense way. Anxiety and depression combined with other modalities of medication and psychotherapy, social therapy, hyperbaric is an adjunctive to anxiety and depression as well. Stay tuned for our upcoming videos where we'll dive deeper into each condition and explain how does hyperbaric oxygen therapy be beneficial for you, your loved ones, and your friends. You're wondering, what exactly are you going to do for 60 to 150 minutes in a chamber, which is actually very comfortable. And what you're going to do is relax. You can watch Apple TV, Netflix, YouTube, or any other show that you've been addicted to recently. As a physician, your safety is our topmost priority. Hyperbaric oxygen therapy is a low-risk treatment, and we personally ensure it's right for you through careful evaluation and collaboration with our trained professionals. While you may sometime need a referral from one of your doctors to proceed with hyperbaric therapy at our facility, you don't need to worry. We coordinate this through our team effort, and the billing is seamless and comfortable as possible. Without getting too technical into the physiology and the inner workings of hyperbaric oxygen therapy, one of the remarkable benefits of the treatment is something called angiogenesis. Angiogenesis is a process through which new blood vessels form from pre-existing ones. This is crucial because wound healing and tissue regeneration ensures that oxygen-rich blood reaches the area that need it the most. If you're interested in learning more about hyperbaric oxygen therapy and how it can help you, give us a call for a free consultation. Thanks for watching, and don't forget to like, comment, and subscribe to more health tips and treatments in the upcoming weeks.